It's not easy to run a clinic in this remote corner of Borneo. Patients come in with malaria, TB, and diseases that should be treated much earlier.
Check malaria, yeah?
Yeah.
Check malaria.
Most people are extremely poor, and healthcare is either unavailable or unaffordable. But this clinic, open since 2007, has flexible payment policies. They don't take credit cards, but they will take just about anything else, says the social entrepreneur founder, Dr. Kinnery Webb.
So you can pay with baskets and woven mats, you can pay with labor, either in the clinic or in our organic garden. You can pay with seedlings that we use for reforestations or seeds. These are also eggshells which we use for compost.
Kidney patient Musadin agreed to pay partly with hard cash, partly with something, well, softer.
People in our clinic can actually pay with manure.
It's collected for an organic farm next to the Health and Harmony Clinic. Dr. Webb says the idea is to treat not just patients, but a larger rainforest ecosystem that's been under assault in Borneo for decades, starting when this vast island was under British and Dutch colonial rule and accelerating in recent years.
It's not only about our physical health, which is incredibly important, and the physical health of the planet, but it's about our soul health. These rainforests and this biodiversity is exquisitely beautiful.
But it's disappearing rapidly. These are the carcasses of lumber mills that fed Asia's economic boom in the 80s and 90s. They simply ran out of lumber, depleting large swaths of trees in a vast area around these factories. In their wake are oil palm plantations, producing cooking oil that's a lucrative export to markets across Asia. Nearby, people struggle on tiny plots of land. These too are carved out of the forest, which have shrunk by more than 50% across Borneo, which is now shared by Malaysia, tiny Brunei, and Indonesia, which officially protects small pockets of land in national parks like this one called Gunung Palong. These parks are the last refuge for orangutans, gibbons, and millions of plant and animal species. And even though they're legally off limits to any commercial exploitation, these parks are not immune from illegal logging, and conservationists who work here say the only way to stop it is to improve the lives of the desperately poor people who live here. Kinnery Webb learned that when she came here in the early 90s. She originally came to study primates, but then was moved by the extreme poverty and poor public health.
And I began to realize what it was like for people who live in tiny little villages in Borneo with just basically no opportunity at all. And I came face to face with what it was really like for the last bits of rainforest in the world. And I just began to think, you know, I could go to medical school and I could come back and I could make a difference here. And yet I never could let go of that love of the environment. And over time, we found a way to really combine those two.
She also couldn't let go of her love of a botanist she met here named Campbell Webb. She finished medical school, they married, and it was Campbell Webb who first enabled the move back in 2007. Harvard University hired him to conduct research in the forest with Indonesian colleagues.
We're able to be here in a large sense because I have a job that enables me to be here, and Kinnery doesn't take an income.
Income for the clinic where Kinnery Webb and about 20 colleagues work comes from a patchwork of donations from U.S.-based supporters, school fundraisers, and in-kind help. For example, medical students and graduates volunteer here, and the architecture department and students at Georgia Tech University have been helping design a new hospital, a project that's also intended to help students learn sustainable building methods.
Tomorrow, we will be going to Batambara to distribute glasses and mosquito nets.
About 8,000 patients have been seen in the 2 years since this 6-room facility opened, but the clinic also travels to villages surrounding the Gunung Palong Park. There's usually weeks of advance notice so people can grow seedlings. They use these to pay for care. The clinic works only in so-called green villages, communities that are certified by the Park Service as free of illegal logging. Patients from green villages also get a discount when they seek care at the main clinic.
And they determine that both through ground patrols and with flyovers of the national park in these tiny little microlight airplanes. We're not trying to catch people. We're just simply saying we're listening to the national park, and together with them, we're going to try and offer you incentives if you're not doing illegal logging.
This event, people got vision tests and glasses. Also bed nets to keep out mosquitoes. And they got a lecture from clinic staff that linked deforestation with increased malaria.
People are saying, oh yeah, we know that's true. There's many more mosquitoes in logged areas. So yeah, they know it and they would love to prevent it. So.
No one values the forest more than those who live around it, she says, even though poverty has driven many people to engage in illegal logging. Deforestation brings disease, floods homes, and affects rainfall for their crops. Many are eager to join conservation efforts and have agreed to report illegal logging coming through their villages from the park. And Dr. Webb says local farmers are happy to switch from their slash-and-burn tradition of clearing ever more forest land to plant crops. The land only remains fertile for a few years before it must be abandoned.
In the first 3 years that you open land from forests and add chemicals, it's quite good. But every year after, production goes down and down. Some of these fields are used 20 years or more, so they are not productive.
Srikandi Ase is the leader in one of several villages where the clinic has introduced residents to organic farming, using soil enriched by compost and manure.
Our old people, our honored elders, they are the ones who cut down the forests, and they are seeing the bad effects on their grandchildren. That's why we're so pleased with this training, that we are learning to do something about it.
Over time, new planting and better land management should ease pressure on the forest. Campbell Webb says it will never bring back the rich biodiversity, but he says it will teach them a lot about reforestation.
We'll definitely learn about what different species need, which ones are good to plant, what methods we can employ to control weeds, and all these different things. So.
And there's still virtue nonetheless in bringing back a forest even lacking that diversity.
Yeah, absolutely. I mean, for all the other reasons, for the economic reasons, for watershed management, for sources of timber, climate control, definitely a forest is better than no forest in these habitats.
How do you know you're succeeding?
Yeah.
What tells you that you've got something that's actually working?
Yeah, it's an excellent, excellent question. We cannot be a failure because we're very lucky to be able to help so many patients. But in terms of conservation, how successful are we being? It's not going to happen immediately. We've already seen a 30% decrease in the number of villages which are doing illegal logging. But we'd like to see much more than that. But I believe that it will take time to do that.
And she plans to take the time. Aside from fundraising trips to the U.S., Kinnery and Campbell Webb hope to spend their careers here.